What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. Today, I have a very special guest who's going to tell us all about the field of pain medicine, as well as why he went into it and some tips for everyone. What's up, Dr. Henry? How you doing, man?
I'm good. Good morning, Dr. Webb. Thanks for having me on.
Absolutely. Go ahead and introduce yourself to all the viewers out there and tell us who you are, kind of what you do.
Sure. I'm Jimmy Henry. I'm an interventional pain management specialist located in the Columbus, Ohio area. I treat patients with acute pain, chronic pain. Most of it is spine-related type pain. And we kind of manage them with different pharmacological therapies, interventional procedures to help them regain their function and relieve their pain.
Got you. And where did you do your training at, your medical school, residency, and fellowship?
So I did my medical school in Chicago at University of Illinois, and then I went on to do my physiatry residency and pain management fellowship at Temple Hospital in Philadelphia.
Got you. And thinking kind of back to medical school when you were trying to choose a specialty, what was it about physiatry that got you interested in it? Why'd you choose to go into that?
So I think physiatry kind of found me. It's not a well-known specialty going into medical school. I did an elective and I shadowed a doctor, and I just kind of became enamored with the variety of patients that we saw. I've always had interest in neuromuscular medicine, musculoskeletal medicine, so it seemed like an appropriate fit for me. And that kind of just led me to get more interest and get more experience, and here I am.
Got you. And for the people who don't know kind of what physiatry is, I know it's a field that not a lot of people may not know about. Can you just briefly explain what is it physiatry is?
Yeah, so I kind of compare it to if neurology and orthopedics and physical therapy all were merged into one. So we're dealing with usually non-acute, non-operative neuromusculoskeletal conditions. So in one day you could see a spinal cord injury patient, you could see a stroke patient, you could see a traumatic amputee patient, and then you kind of weekend warriors, low back pain, joint pain. So we kind of run the full gamut of those conditions, and we follow them long term.
Gotcha. So to become a physiatrist, it requires 4 years of medical school, 4 years of residency, and then a transitional year?
So you'll have an intern year usually in medicine, and then you'll have 3 years of residency, so 4 years total. And then if you decide to subspecialize, which I did in pain management, that's an extra year.
Got you. And what are the other options that you can do after your residency besides pain management? And can you talk to us about why you chose specifically pain management?
Yeah, so other subspecialties in physiatry include sports medicine, electrodiagnostic medicine, pediatrics, spinal cord injury. So what drew me to pain management was really the opportunity to interact more hands-on with the patient. So we had the opportunity to use interventional techniques to directly provide a cure or manage the situation more long-term. So that kind of hands-on experience drew me more to that avenue.
So you completed your residency, your fellowship, and now you own your own practice.
Right.
How did that come about? Did you always know, kind of coming out of training, that I'm going to get out there and I'm going to start my own practice? Because it requires a lot of work. And
it does.
They don't teach us anything like that in medical school or training. So
nothing about it. If they did, I must have missed it, because it's really kind of learning as you go. So when I came out of fellowship, I joined a practice in the Columbus, Ohio area. And that gave me an opportunity to kind of hone my skills. I always knew I wanted to be in private practice. After having different rotations in a VA setting or a hospital setting, I kind of knew private practice was more my speed. But kind of taking the leap and starting your own private practice is something that you're just not really prepared for. So I did my transition kind of abruptly, and I kind of decided it's either you kind of sink or swim. So I just learned as I went. I had a good team around me, and kind of slowly and organically our practice has grown kind of 4 years later to where we are now.
And for the people who are currently in training, either medical school or residency, is there anything that you recommend, books they may read or courses or things that they can do if they know they want to do in private practice and start their own business once they're done?
Is really take every opportunity you are to seek mentors and people who are doing what you would like to do. If you can't really see it, it's hard to envision yourself doing it. And then take every opportunity as a lesson. So you'll pick up things that you would like to do, and you also learn things you don't want to do, or see the wrong way that people do things, and adjust from there. So as you go, just have a good team, advisors, lawyers. There's a lot of paperwork behind the scenes that goes into, you're running a business in addition to being a doctor. So you have to be vigilant about looking at your numbers, your overhead, your staff. While you're trying to provide the most comprehensive care you can, you want to make sure that you're not in the red either. So,
gotcha. What is a typical day for you? Usually starts at what time and ends at what time?
Yeah, so pretty much 8 to 5 every day in the clinic, or in the practice. So half my week I'm in clinic seeing new patients or follow-up patients. I do some electrodiagnostic medicine as well. The other half of the week I'm in procedures or in surgery. So I have about half of the week I'm in surgery. We do lots of neuromodulation medicine, which involves spinal implants for chronic pain. And then I do in-office procedures for chronic pain as well.
Gotcha.
Yeah.
For the people who want to go into medicine, maybe physiatry or just medicine in general, or become a pain medicine doctor, what type of advice would you give them?
I'd say along the way, just have to not give up. I remember back in pre-med, back in undergrad, I remember my advisor not being all that optimistic about my options going forward. But I just say be persistent, don't give up. The world needs more doctors like us. And I think once you kind of get through that weeding out phase of pre-med, you make it into medical school. Really the sky's the limit, because you're kind of built for it. After you've overcome all the obstacles, you realize nothing really can stand in your way. So really don't get discouraged by the naysayer, just keep on pushing.
Some really good advice.
Yeah.
3 last questions, and I ask this of all my guests. You can give a 1 or 2 word answer. Sure. What is your favorite thing to do outside of medicine?
I'd say eat vegan food. Actually, I've been vegan for a couple of years now, and I'm really finding it's a very appealing diet to have. Yeah.
Got you. Do you have a particular aspect of pain or physiatry that interests you the most?
I really like doing the procedure part. Probably my favorite procedure would be kyphoplasty, which we do for compression fractures. You're injecting cement into an actual fracture to help it heal. So I do like that procedure.
Got you. And I guess this is a little bit backtracking. Some of the other procedures that you do, you mentioned like spinal cord stimulators, kyphoplasty. What other type of procedures are you kind of doing in office versus surgery?
Yeah, so kind of the main things we do, epidural steroid injections for kind of sciatic type pain, radicular pain. A very common treatment we offer is something called radiofrequency ablation, which is for kind of facetogenic spine pain. So arthritis riddles a lot of different people, but they don't know that that's an option for spine-related arthritic pain. We treat SI joints, pretty much every peripheral joint or nerve that's a source of pain we can block. So.
Gotcha. And you mentioned the kind of the vegan diet, which you're a couple years in now.
Yeah.
Have you found a particular food and like a vegan type food that you enjoy the most?
I'm Caribbean, so I really like plantains. I really like cabbage, eggplant, like that kind of food. So.
Gotcha. And if I'm not mistaken, you're from Haiti?
Hey, yeah. So I was born in Chicago, but my parents are Haitian. Yeah.
Haitian. What part of Haiti?
Port-au-Prince, which is the capital city. Yeah.
Gotcha. Yeah, I've been there twice in the last, I'll say 2 or 3 years. So
great.
Really enjoyed my visits. Went to Huey, the hospital right there downtown Port-au-Prince.
Great.
And it was.
We'll make a trip together one day.
Yeah, absolutely. Yeah, I'd love to go back here. I'm actually talking to a surgeon who's been over there about 50 times in the last 20 years. And I just ran into him the other day, and hopefully we'll be planning another trip here soon. So
great.
Dr. Henry, thank you so much for joining us today and kind of sharing your story. You're a real inspiration to a lot of us out here, including myself. If anybody wanted to get in touch with you, or if they're in the local area in Columbus, or they want to be seen by your practice, how can I do that?
Yeah, so we are Midwest Spine and Pain. You can look us up. Our URL is www.midwestspineandpain.com. We're on social media at Midwest Spine, and we're glad to help.
Awesome. For everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. We'll see you next time.